Hi there. I'm going to show you a kind of calming, relaxing, deep breathing, let the body relax, kind of deep breath, pelvic floor, diaphragmatic breathing, however you want to call it. It's about letting your body let go of tension. So much of the time we think that we have pain because we have too little strength. We're not strong enough to keep our body stable, and therefore we're just so easily put out of place or whatever. I hear it all the time. And actually, a lot of the time, it's that we're so tight and we're so tense that we actually don't move the way our body's meant to move. And that is actually creating more of our dysfunction and our pain. So what I want you to do when we're doing this is go really slow, really thoughtfully. This is about connecting what you feel to your brain, to your body, and how maybe you might be able to change how you feel, how you might be able to change where you're really, really holding down some tension. So you're going to do this at the rate of breath. And generally the rate of breath should be about 3 to 4, maybe 5 seconds in, little pause, 3 or 4 or 5 seconds out, and a pause. Okay? So the idea is that you do this with no effort. So no effort. I cannot say that enough. You're trying to relax, not trying to tighten. I want you to picture, as you take a breath in, it'll be that nice slow breath I just mentioned, that you're bringing air in. The diaphragm, which sits right about here, is pulling and contracting that air. And it's got nowhere to go. The air is coming in your lungs and you're pushing something into you. That means it's got to go somewhere. And if you just keep tightening and pushing air in, it makes it more tight and more tense. So we have to think about the rationale behind that. If you're bringing air in, the belly is actually supposed to relax and expand out. Because air is going in, it's got to go somewhere. It's the same thing on the sides of your body. They need to expand. It's the same thing. It should come into your lower back. It should also go down to your pelvic floor. We forget that we have this little sling down here, and it's full of muscles that contract and muscles that relax, but we forget that they relax. So when air comes in and the belly goes out, the rib cage expands, the back relaxes, it doesn't tighten, it relaxes. The pelvic floor should actually descend down. You should feel a little bit of weight going down because air is pushing it there. Some people liken it to flower petals opening. So as the air is pushing down, it's actually like they're opening up. You actually should feel dissension of that area, okay? As you breathe out, you don't push it out, you relax it out. So it's like a balloon pulling in air in, it's filling up, and then it's deflating. Not with that noise that you'll do, but the balloon would, and it deflates out. So should the pelvic floor. So the pelvic floor has just been brought in with breath, and then it deflates back out, and it rises back up because there's no air pushing it down. So we're going to do this together. I'll try to talk as I'm breathing, but it's complicated. So this is my best shot. I want you to take the nice, slow, deep breath in. I want you to feel the air slowly breathing down, letting your belly expand, the rib cage expand, the pressure of releasing in your pelvic floor. And then you slowly let it out. Let everything soften. So the pelvic floor gently rises up. The ribs come back and compress in. The belly comes back to a state of calm. Some people at the end will feel like they actually want to give a little squish and almost push out the air at the end. And that's okay. At the end. Don't bring in the muscles before the end. Let them deflate on their own. And then at the end, if you want to give a little bit of a squish of that belly button towards the spine, I'm okay with that. Then you go back, you breathe in. Feel the belly relaxing, feel the wideness of the ribs, feel the descending of the pelvic floor, and then relax and let it breathe out. Feel the pelvic floor gently rising up. It should do that on its own. You shouldn't have to grip it and necessarily pull it up. You might at the first just to kind of get that sense, but after a little while, it should just be the natural recoiling factor of those muscles because you just stretch them and now they're recoiling. So I would try that a few times. Do it at least 4 or 5, maybe 10 times. at once, because every time you do it, you actually get a little bit more mindful. You get a little more thoughtful. You get a little more relaxed. And then, as you start to get more comfortable, you can start to increase with like a little bit of like a posterior tilt or a roll back. That's kind of a separate exercise because you are thinking about different things. You might get really good. That might become very normal to you. But if you're just starting with the release of the pelvic floor and the release of the belly and the release of the sides, that might be where you kind of stay for a while. And then you could separate out and start adding a movement. And there's another video on this website that you can check out for that.